So the race is on to develop a safe and effective COVID-19 vaccine. Experts hope to have one ready by the end of the year or early next. Meanwhile, we are learning more about what a vaccine rollout would look like here in New Mexico and who would be first to get it. Kai Porter is now in our newsroom with more information. Kai.
Well, Steve, Governor Michelle Lujan Grisham was asked about this in her weekly news conference yesterday, and she says the focus will be on vaccinating those high-risk groups first. When a vaccine is ready, Governor Michelle Lujan Grisham says she'll mandate that New Mexicans on the front lines of the pandemic and our most vulnerable citizens are the top priority.
You go to healthcare workers, you go to nursing home residents or high-risk populations, you go to first responders and workers. When you do that, you work to nearly eliminate, all the high-risk, high-mortality groups. The educators would also be in that group.
Then the focus will be on the rest of the population, but it will all depend on how much vaccine is immediately available, something we won't know until it's rolled out.
After the groups in that public health list have access to a vaccine and are vaccinated, if it's widely available, I'm getting a vaccine, I would want my family to get a vaccine. I want them to be as safe as they can now that we have this deadly virus living among us.
Another question that remains is how effective a vaccine will be. Dr. Anthony Fauci, the nation's top expert on infectious disease, talked about the possibilities during an Instagram interview with actor Matthew McConaughey.
There are very few vaccines that are, in fact, there are no vaccines that are 100% effective. Vaccines like measles are 97, 98% effective. If we get 50 to 70% effective with this vaccine, I will be very pleased.
50 to 70% effective will be pleasing.
Yes, you know why? Because then we could combine it with public health measures.
And worldwide, 25 vaccines are now in human trials, and experts say multiple vaccines will likely be needed. Back to you.